Hello YouTube, I'm Dr. Fox. Today, let's think about this question together. Is there a minimum age limit to access contraception? My answer is that there are no minimum age limits for contraception, so you can get contraception and confidential advice if you're under 16 years of age. However, healthcare providers in some nations must follow some guidelines with young teens. In general, you need to be mature enough to understand the advice you are given and the decisions taken about your contraception. Deciding when and whether to have sex is difficult. When people do choose to become sexually active, they need to be responsible for the possible results such as STIs or sexually transmitted infections and pregnancy. In some countries, most teen pregnancies are unplanned. To protect yourself from the risk of STIs and pregnancy, you must use a condom every time you have sex. Of course, the best way to avoid both pregnancy and STIs is not to have sex, or in other words, to be abstinent. That means no close genital contact as well as no oral or anal sex. When you do choose to start having sex, there is a wide range of birth control methods available, which can also have secondary benefits such as reducing acne and premenstrual syndrome or PMS. Okay then, when is the right time to start using birth control? If you're thinking about having sex anytime soon, you need to start using birth control. You can fall pregnant from your first time, so it is never safe to have unprotected sex. A variety of birth control methods are available, with some types being more effective than others. However, any birth control is preferable to nothing, and people who don't use birth control and have sex are 85% more likely to fall pregnant within a year. While stopping pregnancy is the most important reason to take birth control, certain types of hormonal birth control methods, including the patch, shots, pill, implant, hormonal IUD, and ring, can have another advantages. For example, they can reduce premenstrual syndrome, cramps, and the heaviness of periods. Also, the ring, patch, and pill can help improve acne and the regularity of your periods. At some time in their lives, most people will use birth control. If you think you might have sex soon, it's time to think about birth control. The first step is to talk to your doctor or visit your local obstetric and gynecological clinic. Okay, next, how can you access birth control? You can buy certain varieties of birth control such as condoms from pharmacies and supermarkets. You don't need a prescription or to show any type of ID to buy condoms. As well as preventing pregnancy, condoms will also help protect you from STIs. Even if you're taking another type of birth control, using condoms is still a good idea. The effectiveness of birth control varies depending on what type you use. Some of the most effective methods are the pill and IUD, but you will need to speak to your healthcare professional to access them. Your doctor will be able to provide you with these forms of birth control. You don't usually need to undergo a full medical exam to access birth control, but everyone is different. Your experience will depend on your health and the policies of your local clinic, as well as the type of birth control you would prefer. In general, the nurse or doctor will ask you about your past and present health, called your medical history, and will check your blood pressure. Very occasionally, you will have a pelvic exam. A healthcare professional may also ask questions about your sexual activity. For example, if you have had sex, what kind and with how many people, and if you have ever used any birth control previously. To get the right care, you must be honest. No one is interested in judging you. Doctors aren't there to judge, and they've had it all before. They just want to help you stay healthy. This is also your chance to talk any questions you may have. For example, you may want to know about IUDs, as these are the most effective birth control methods and the simplest to use. Will your doctor tell your parents that you are on birth control? Your local clinic's policies and the law in the region in which you live will decide whether your parents are told about any birth control you receive from your doctor. However, the law in many places allows teens to access birth control confidentially. Even if your parents don't need to know, it's always a good idea to talk to them about it. Okay, what if you don't use birth control correctly or at all? If you don't use birth control when you have sex, or if you don't use it correctly, there is no need to panic. Emergency contraception will give you a bit of time. In sum, emergency contraception is a method of birth control that can stop pregnancy as many as 5 days after you have unprotected sex. It involves having an IUD implanted or taking what is commonly called the morning after pill. You need to act quickly with this form of emergency contraception as it works better the quicker you take it following sex. The type of emergency contraception that works best is the copper IUD, which must be implanted within 5 days of having unprotected sex. However, as a doctor will have to implant it, it may be difficult to get an appointment in time. If you have unprotected sex, speak to your doctor as soon as possible. They can help you to decide what to do next and will give you more information about your options. Okay, thank you for watching. See you soon.